Right, good afternoon and welcome to the meeting of the Health and Adult Social Care Scrutiny panel. I'm Councillor Bill Armour, I chair this particular panel and my members are, starting with Councillor Munro. Could you like to introduce yourself?
Hello, I'm Councillor Munro, representing residents in Almonbury Ward at Kirklees Council. Thank you.
I'm Helen Clay, voluntary co-optee.
Hi everyone, I'm Itrat Ali, councillor for Murfield Ward.
Yes, thank you. Do we have any apologies?
We do. We have apologies from Councillor Beverly Addy, Councillor Habib Anzaman and Kim Taylor, who's a co-optee.
Thank you. Minutes of the previous meeting, they have been circulated. Are we all happy with them? Yes, we approve them?
Yes, thank you.
Right, thank you. Do any members of the panel have any interest to declare? I do not.
No, Chair.
No.
No.
Thank you. Admission of the public. This is a meeting held in public. I don't think we've actually got any members of the public present, but they are welcome. Do we have any deputations or petitions?
None received, Chair.
Thank you. Do we have any public questions?
None received, Chair.
Oh, thank you. We're just moving through in good order. Just a little bit of information for the benefit of the panel. With the unexpected closure of Valley View Care Home in Almonbury, I requested a chair's briefing on the situation. And on the 21st of February, I was briefed by Michelle Cross and Richard Parry, who are senior Kirklees officers. With the care home being a private facility, Kirklees was informed at very short notice of the closure decision. Officers and social workers had moved quickly and started to have conversations with families in the same week the closure was announced to discuss their options. I was very pleased and relieved to hear that there is sufficient capacity across the sector within Kirklees to accommodate the 46 residents. No information had been shared with Kirklees by the operators on why the business was not financially viable, although my understanding is that this home is owned by a larger organisation which reaches beyond Kirklees. This situation points to a problem inherent within the system, but it's not within Kirklees, it's within the national system. Because, with two exceptions which feature in today's business, residential care for vulnerable people is provided by the private sector. Kirklees has no right to become involved in management issues at an early stage. Indeed, such matters may be considered to be commercially sensitive and may not always be shared with officers. I appreciate that this means that our officers need to be alert and nimble if they are to respond to unexpected changes in provision. And certainly I commend them on the very rapid reaction here. Thank you. I understand that item 7, we have a little bit of an issue, so I'll move to item 8 on the agenda, which is the future of council-run dementia care homes. We do have colleagues here, yes, and we also have, I believe, Councillor Jackie Ramsey. Oh, yes, the cabinet member responsible. Please, if you'd like to introduce yourself, would you go?
Oh, it's that middle. Apologies. Good afternoon, everybody. I'm Michelle Cross, Service Director, part of Adult Social Care Management Team. And the first item is the Cabinet proposal for the future provision of council-run long-stay dementia homes, which will be going to Cabinet on the 12th of March. Just by way of reminder, appreciate that panel have had the paper that's on its way to Cabinet. But just by way of reminder that we undertook a 12-week consultation And the paper does identify the findings and impact of that consultation, and we are seeking approval of Cabinet to explore potential opportunities to transfer the homes to the independent sector. The reason for that recommendation is we've been approached by several independent providers who wish to explore this as a potential opportunity. However, just to point out that the council will continue to operate the homes. We will continue to operate their homes at the current time, and thereafter, should this exercise not be successful in transferring them to the independent sector. And that is the recommendation that is going to Cabinet on the 12th of October. You'll see from the paper that we had significant responses to the consultation, with over 400 respondents, and 80% of those respondents disagreed with the closure of those two homes. You've seen significant media presence and social media presence and obviously presentation here on several occasions and at other formal political forums. You'll see that the consultation is comprehensive. We did consult with a number of stakeholders, a number of partners, with families and carers and residents, and on numbers of occasions we did face-to-face sessions with those families. We did financial workshop sessions with the families, and we were out constantly talking to staff and with residents and families throughout this 12-week consultation. And as you'll see from the paper, that is a recommendation that's going forward. And just to finish, do panel have any questions that they'd like to pose following that paper?
Yes, thank you for that. The first thing I'd like to say is this does demonstrate that Cabinet and the Council have actually listened to the concerned residents, very concerned, and I would like to say that the residents, or a group of the residents, have been very active in putting the case forward. I think that this does seem to be, perhaps victory is not the correct word. It does demonstrate that the Council does respond to public concerns, and I'm pleased to say that this panel has, in the past, we have given time to the relatives to get their points across. I personally am pleased that the position does appear to have changed a little bit, and quite a lot actually, and I think that the chances are that we will get an outcome that will be much more satisfactory for the concerned relatives. Having said that, I understand that Helen would like to make a point, ask questions.
Thank you. In terms of the future and whether they are or aren't transferred to independent sector, is there a view at this stage of what they'll look like? You know, will the capital work still go ahead? Will it change the type of service that it provides? Will it be more specialist and sort of the people that are more difficult to place? Well, you know, are you in a position to be able to advise on that? Thank you.
Would you like me to respond, Chair? Yeah, the intention is to start the capital works again. As you know, we did pause those works pending the consultation. So we are back to Capital Board to reinstate the capital funding that was identified against those two homes. We will also be going out and filling the beds because we paused some of that potential through the consultation also. And you'll remember as panel that when we came and presented last time, the reason that some of the beds were preoccupied was because we were waiting for No Park House to be open and up and running. There are 10 beds that have been taken out of that facility, but No Park House opens this spring. So we'll be able to reutilise that wing of 10 beds at Castle Grange. And Claremont House, there were significant works that were required on one of the wings to be CQC compliant, and we will be undertaking those works in the summer. So that in terms of your question, Helen, around the expectation and what we'll be working towards in terms of future provision, absolutely we'll be looking to be more specialists in complex dementia. And the other thing that we may be considering is supporting people who are self-funders much more than we currently do. And that's not chasing self-funders, but I think what we'd like to be is best in class, so that we are attractive to that cohort of individuals, and not necessarily in competition with the independent sector, but certainly something that we would be looking to achieve, because that does maximise income as well. So it's maximising the asset, but also maximising the income that we can pull into the council.
Thank you, that's really helpful. In terms of the impact of the decision, what will that impact be now in terms of the council and funding and you know, that how is there something else that's going to have to change because of that decision?
Not at this current time. There was sufficient funds to support the £1 million saving the adult social care that came in from central government, and that's been used as part of the adult social care budget saving, so that's been sort of eradicated through this year. And again, the reason that we need to maximise the asset and the income is to make sure that we are in budget next year. So it will still be challenging, but the expectation is once those beds are full, we will see a significant increase in income. The difficulty that you always have is balancing that budget, but the way that the budgets are built up year on year is that is the budget for the establishment. You can't team and ladle the budget because you have minimum staffing levels to achieve, so the budgets are already built in base. So that in itself, and just to kind of highlight that we will be out to recruit because we've been holding vacancies equally, and that will offset the agency costs. So all of that in the round should mean that we are spending less than we currently are. Thanks, Helen.
Councillor Ali, did you have a question?
Thank you, Chair. No, I just had a question around working with partners. So you state obviously the next steps are to formally explore the commercial partnership arrangements. Obviously, I understand that you can't go into detail due to confidentiality about those partners, but would you be able to elaborate slightly on the process and how they'd be vetted and what type of partnerships we're looking at, and how will they be assessed moving forward in terms of their suitability, and will that be an ongoing process, and will you evaluate it before a decision's made?
Yeah, I'll just break those
Sorry, there's a
things
lot of
down. No, it's
questions.
fine. It's fine. We have had initial informal conversations with interested parties, of which there are 4 parties that are interested in purchasing the homes as a going concern. What we will do now, because that was a point in time when the proposal was to close. So we will be back out to say that potentially they would be looking at a fully established provision, fully staffed provision, and the risk that is associated with that, because that does include TUPE, and it also includes pension sustainability, in which any independent sector provider would have to think about a bond and joining the West Yorkshire Pension Fund. So the process for going out and consulting with those potential providers is to provide that information. They will then have to provide significant financial proof that they can afford all of that and the bond that would be required. So myself and the head of risk are going back out and talking to those providers to give them more detail, because it was really difficult to do that at that current time, because it is commercially sensitive, as you say, and we didn't know what the decision was. So we can go back out now with more detail. And just like to remind panel that we have done this exercise previously, where we did this exercise in 2017, and it wasn't successful for the very reasons I've stated, because the financial availability of all of those funds up front are very very, very difficult for an independent sector provider. But I think because we're being approached, I think it's only fair that we go back out to those who did come forward and say that they were interested. Through those 4 that were interested, none have worked with local authorities before. So we'll have to see what the outcome is, and absolutely, should that process become a viable option, then we are likely to be back into what might be consultation again. And we'd have to seek Cabinet approval at that point anyway. Is that okay? Thank you.
Do you have any further questions?
No further questions.
Councillor Munro.
Thank you, Chair. This question kind of follows on with private providers taking on both care homes and what that might mean for patients. Because I noticed from some of the feedback from the consultation, people were concerned, albeit at the time, you know, the care homes were going to be sold. People were concerned about the welfare of patients. And so my question really is about, you know, if private providers do manage to take over these care homes, what that might mean for existing patients and their families in those care homes. May they have to pay top-up fees that they previously didn't have to pay? What may happen if the private care providers want to carry out renovations to the buildings or for, you know, whatever? Would they maintain capacity at 40 beds for each care home? Could you answer any of those questions at all, please? Thank you.
I mean, some are difficult to answer, you'll appreciate, until we've gone through that absolute exercise with those individuals. In answer to your question, we would be identifying early on that they will be taking residents at current fee rates, and again that's why we need to go back out to those providers and stipulate what the terms of those transfers would be, and that would be a legally binding contract with those providers, so we'd be seeking legal advice at that point, and that's kind of the exercise that we undertook last time. And it's fair to say that because of all the legalities and the transfer and the expectations within that contract, it does become quite unfeasible for a lot of providers. In terms of whether they would want to do renovations in the home, that would be part of the transfer agreement and negotiations, because, like I've said, they'd be sold as a going concern. So in essence, the buildings potentially could be theirs and not ours, because that's what you get the receipt back for. So again, it's all work in progress, and until we get to any kind of finality of that, it's really difficult. It's really difficult to say, but I suppose the expectation of Scrutiny will be, as and when that progresses, we'll be back with updates. But it's really difficult to say, because obviously there are some unknowns yet. Thank you.
Thank you, Chair. That's it. Thank you.
Right, thank you. I think there's just one thing I'd like to add, which is very, very noticeable when the relatives were initially concerned about proposals, is they all mentioned that in their view there's an excellent standard of care being provided by Kirklees and by its staff. I think that's worth noting that Kirklees staff came out very, very well on the standard of their services. Thank you.
Thank you, Chair.
Right, item 7 is still a little bit problematic, so we'll move to item 9 on the agenda, preparation for Care Quality Commission inspections. And who's going to lead on that one? Would you like to introduce yourself?
Thank you, Chair. So I'm Alexia Gray. I'm Head of Quality Standards and Safeguarding Partnerships in adults, and I'm here to update you today on the progress with the CQC inspection regime and how, well, hopefully to provide some assurance to the panel of how we're preparing should we get notification. So I know you've had the slides in advance, so I'm going to hand over to Kath after I've done my bit to talk more widely about the change programme that we've got planned for 24-25. So with the introduction of the Health and Care Act in 2022, It placed a duty for the CQC to independently review adults within the local authority, basically to assess how effectively we're discharging our duties under the Care Act. So the way that the framework is set out is that there are 4 main themes. So there's working with people, providing support, ensuring safety and leadership and workforce. And then underneath those, there are a number of quality statements that form the basis of a self-assessment for us to use to be able to check how we think we're doing and across the partnership. So in terms of the outcome, it's the same rating system that's used already in regulated services, so inadequate, requires improvement, good and outstanding. And they're really determined by 3 areas. So what we're doing in practice, there's a real focus on practice. What frontline staff, carers and people who use services say about what we're doing, and the story that we tell during the inspection when they're actually on site and getting to meet people. So we have got a set approach, which is based on looking at evidence and improvement, the policy, procedure and performance information. And I think the most important one really for us is around the voice of lived experience. There's a real focus on that, and we've seen that come out of the pilot sites that I'll touch on a little bit later. So in terms of the timetabling, during 2023, they inspected 5 pilot sites that were local authorities that volunteered. And then they announced that they would be notifying another 20 local authorities between October and March. So they contacted 3 before Christmas, 7 at the end of January, and they've just announced last week another 6. So there's about 4 more that we expect to get notified before the end of the financial year. We don't know how they schedule inspections. What we picked up is that they seem to be notifying people that are on the same ICB footprint. So we've just got to be in a state of readiness as much as we possibly can. So in terms of the pilot sites, there were 5 of them: Birmingham, Lincolnshire, North Lincolnshire, Nottingham and Suffolk. And they all were rated as good, apart from Nottingham, which required improvement. There was a shortfall, or a couple of shortfalls in some areas that brought their rating down a little bit. So we know that when the inspectors visit on site, again, this is learning from the pilots, that there are people that they will absolutely want to see. So as you would expect, the Chief Exec, the Director of Adult Social Care, public health consultants, principal social workers, and very much, like I said, putting the focus on people who use services, carers. So we would, for example, want them to link in with our co-production board, but also care providers. With the pilot sites, they did send out a survey to providers in advance of them coming to get that feedback. So some of the focus of inspections, it's very wide, but they looked at the AMP teams, carers, commissioning and provider development, the contact centre, the front door, transition, safeguarding. So it's the whole breadth of services, basically. And some of the key findings, and they are listed on the slide, so that there were some positive findings around prevention approaches, performance management, where strengths-based working was well embedded, but there were also areas of concern that were themes that were coming out of all of them. One of the main ones is where excuse me, the data didn't support the stories that people were saying. So we're doing quite a lot of work with our colleagues in the Business Intelligence Unit to assess all the data that's publicly available, because they will do the research on that before they then come to speak to us. So we need to make sure that that does tally up. And then other significant areas of concern were around inequalities, and also around high caseloads and just the general pressures across the workforce. So where we're at so far, we quite quickly developed our governance structure. So we do have a CQC assurance board, and that's chaired by service directors, and we also have a project group that's sat underneath that is more of the leads on the work streams and feeds up to that group. We've developed what we're calling a go plan, so that we're ready for when that call comes in. I think it's important to note that it is a little bit different excuse me, to the way that Ofsted works, because with Ofsted they get the call and then obviously the land pretty much the next day, whereas with CQC, we'll get the call and then we've got approximately 8 weeks notice, so we have got that little bit of time to prepare, but obviously we need to be on top of it as much as we can. So that Go plan's been developed. We've got a lot of support at a regional level through the various networks, through ADAS, Local Government Association. We've done our draft self-assessment that we're hoping to start sharing more widely, and obviously that's quite a difficult document because it's dynamic. It's only, you know, today is the day that we're on, so we've constantly got to keep on top of that. But we've also spent and invested quite a lot of time in pulling together a lot of evidence. So we've got a huge amount of evidence that includes things like storyboards, you know, where we want to spotlight on good areas of practice, things that have come out of staff surveys and things like that. So we've done a lot of work around communicating to staff and to lots of different boards and groups. We've got quite a comprehensive directorate communication plan because there are so many other big pieces of work that are happening at the same time, so we wanted to make sure that that was coordinated and that we were getting the right message out to staff at the right time, so we're not sort of inundating people. And as I said, we're building up lots of case studies. They seem to be very interested in storyboard type approaches to tell the story. As I said, there's a lot of work happening around the data side of things, which has been even more important with the introduction of the new case management system, which went live on Monday, which is really good news. So just a little bit about the self-assessment. We've done that, as I said, and what we've done is we've pulled out the areas from that we think we need to develop, and that's forming the basis of a development plan. But that is, again, it's important to stress that that's not necessarily around CQC, that's around us wanting to refresh the vision this year, so it's connected. The vision is the overarching development plan, and then there are other things that connect around that. So that CQC being one of them, the change programme that Kath's going to talk a little bit about, and obviously the budget savings and, as I said, the case management system. So in terms of some of the challenges, it's keeping that activity live because, you know, we could get a call next week or it could be in 12 months' time, so we've got to keep that momentum, keep on top of everything. We also are doing, or we've got a rolling programme of work with staff so we can help to support them and prepare them for inspections if there are particular groups of staff that they want to speak to. And we're also looking at how we can select the cases for the case audit because they will select a sample. It's a very small sample, but nonetheless we need to make sure that we're ready for when that call comes in. So as I said, we have got a few challenges because we have had the introduction of the new system, which has been quite a hefty piece of work, so we're all delighted that that's gone live. We've got the scale of the development plan alongside what Kath's going to talk about. We're sort of coming out of winter pressures a little bit now, but obviously if that call had come in around Christmas time, it would have been added even more of a challenge. And then obviously there are external influences that, you know, we've got potentially a general election, and revised focus could be back on social care because some elements of the original reform were deferred, but if that comes back in, then that will present another set of challenges. So I'll hand, would you prefer, Chair, to ask questions around the CQC bit first and then hand over, or do you want?
Well, I think we'll have to see if there are any questions about that first part of it.
Yep, that's fine, thank you.
So, panel, will be any questions? Yes.
Are there any, from the work that you've done so far and the evidence that you've collated and all the rest of it, are there any benefits that you found for the service just by doing this piece of work?
I think it's made us focus on things that we are doing particularly well, that we've wanted to shine a light on that, and reflect. It's made us reflect back actually on the vision itself and what a lot of that's led to. So a lot of the co-production work that we've done, and the value of doing that with things like the we're currently doing the direct payments policy, so things like that we want to be able to shine a light on. And then there are other bits that I think we're not saying that we're not doing it, but it's something that we think actually we need to prioritise that a little bit more. So there are pieces of work in there that we think will naturally be picked up through the work that Kath's going to talk about. But we're more than happy to share that self-assessment when it's just with the strategic director at the moment, and then we will be sharing it. It's quite long, but there's so much to get into it. But it has made us reflect very much so. So we'll share that as soon as we can. Thank you.
Councillor Munro?
Okay, I was just going to ask, so if the call came in, do you feel that you'd be able to, you'd be prepared if the call came in from the CQC?
Yeah, I think so. I think we've got, like I said, there's sort of two elements of it. There's the logistical planning, so around, when they're actually on site and, actually getting the timetable in of that together, which we've done as far as we can. We were very fortunate in that we did have a peer review booked a couple of years ago, which ended up getting cancelled through illness. But so we've got the bones of that timetable that we can just lift and because it'll be the same people that they'll probably want to speak to. And then in the 8-week period that we've got, that'll be where we'll need to get the case file audit material, which we'll work it, so we know that we'd be in a position to do that, and then all the literary and policy and procedural things that they want to look at, that's all in one place as well. So I feel as confident as we can be. And from, again, some of the pilot sites, they will do their own research in advance, so anything that's publicly available in terms of data, policy procedures, if they do, they might do some mystery shopping, on the website and that type of thing. And then that may go on to form a particular line of inquiry, but obviously we won't know that until they've had the submissions of what they've requested. Thank you.
Thank you, Chair.
Councillor Alvey, have you any questions?
Nothing specific, but in terms of your communication plan, is that available to us or to the team?
Yeah, it's quite a high-level one because it links together lots of different programmes of work. So what we've done is we've referenced on the bottom of it where there is a specific plan. So, for example, the case management system, that's a huge comms plan in itself. So to try and overlap everything in one plan, it was just going to be, a bit of a mammoth document. But no, there's no reason we can't share that. Send that through.
Right, thank you. I just noticed that Health Watch Kirklees seem to have had quite a number of requests for information from CQC in the last 6 months of last year, so perhaps they're winding up for it. If you'd like to continue with the second part, please.
Okay, thank you. Hi everyone, I'm Kath Sims, Service Director for Adult Social Care, work alongside Michelle. So I'm just going to give a quick update around some of the work we're doing around the Adult Health Change Programme. So as some background, you'll be aware that we were working pre-pandemic, very much working towards implementing a strengths-based approach in Kirklees around our support planning, our reviews and our assessments, which is about supporting people to access community facilities, supporting people to kind of identify their own strengths, people around them that can support them, and giving that support so that people can, live a life how they choose to live it as independently as possible. We had a really good, strong offer at the front door and in terms of our community teams, so Community Plus offer, very much focused on prevention, well-being and creative thinking around sort of how we can support people to identify and solve their own problems. In acute settings, so in hospital settings, there were some challenges around hospital discharges, but they tended to sort of peak over winter, maybe during bank holiday periods like Easter. But generally it was manageable, and we worked really well with our acute colleagues and the care sector to support people out of hospital well. Like Alexia's touched on, we had some really good work around co-production and work with people about how we want to develop our services moving forward, and had a keen sort of focus on thinking about developing more extra care, reduce that reliance on residential care, and supporting people really in that strength-based way. And I think like all councils, that was on the back of the Care Act coming in 2015 and just supporting people around their health and well-being. We've talked a lot about what happened when COVID came along and the impact of that, one of the main things was just the demand that was coming then out of hospital discharges. So we've seen the number of hospital discharges almost double in the years since COVID hit. So it was a real quick turnaround of people going into hospital and wanting to come out of hospital quickly, pressures from the NHS to move people out of hospital quickly, perhaps into short-term care beds, which really changed some of that practice and that focus on supporting people about what's good for you, how can we support you to be independent, into quite a transactional, we need to support you to get out of hospital, to protect the NHS, as the tagline went, and then do that work. So it became quite transactional really, and quite a problem fixing mode as well. Thinking about all the work that was happening around the communities and building and strengthening our communities, they changed as well to respond to the pandemic. So a lot of our voluntary sector organisations did really brilliant work, but different to what they were doing pre-pandemic, and again supporting people in a very different way. I think there was other pressures that were coming in at that time as well. So we had the social care reform plans, delays in some of our extra care and housing developments, and some impacts in the provider market. So our provider market was sometimes struggling to respond to, again, that work coming out of hospitals as well as through the front door as well. So that's happened. The way that we were working has changed, and we identified that actually we needed to get back to how things were pre-pandemic and actually refocus how we wanted to work moving forward. So last summer we commissioned an external organisation to come and conduct an independent diagnostic about how we were working, and the primary aim of that really was just to look at how we can improve outcomes for people in Kirklees, and really going back to what Alexia said, how we're working and how that reflects our vision. Had we moved away a little bit from the vision, or were we still meeting how we said we wanted to work? What they found, and some of the findings from the diagnostic, we kind of triangulated against that work that we'd put in for the peer review, as well as feedback from people who we've supported, feedback from staff. It was a really significant piece of work where our staff teams and managers really inputted into that diagnostic as well, and say what was working well for them and what was working well for the people that they support, and any areas for improvement. Like I say, there's those other impacts as well, like the reform, CQC, cost of living impact, national workforce challenges. So, we know that during COVID, there was a huge impact on not only our qualified social workers and being able to recruit to those posts, but our care providers as well. So there's been some real challenges and continue to be now. That diagnostic really just gave us an independent view of what we might want to do differently, what we might want to change, what we might want to build on that works really, really well. So we've taken all of that work and designed a plan that is going to sort of run, well, through the next 3 years, but the majority of the implementation is happening in the year ahead. So we have kind of been working over this past 3 to 4 months to really develop and refine our plans to implement what came out of the diagnostic, how we get back to meeting our visions, our aim within the visions, etc. So there's 4 key work streams for the change programme. One is looking at the front door, so just thinking about that strength-based decision-making at the front door, having a conversation with somebody when they ring up, asking what's important to them, connecting them to where they need to go, rather than say, oh, you've asked us for some support, we've got to put some support in, which had become quite a transactional approach. The other work stream is around adults, so supporting older people and people with physical disabilities, and again getting back to that strength-based way of working, thinking about some of our pathways. We'd put some changes to our pathways in during COVID to respond to the challenges that maybe don't work quite as well as we'd want them now, so just making sure that we can streamline the way that we work for people so that they don't get passed from team to team. Thinking about our reablement services, so again, reablement has very much had to focus on supporting people out of hospital, and then has moved away a little bit from community referrals. That is people who were ringing up and saying that they would need some support now. In the past, we would have said, well, let's support you to access reablement first, and they can get you back up onto your feet first before we put in a package of care. We want to get back to that so that reablement aren't just responding to hospital discharge, but also anybody new coming into services as well. and then a work stream looking at learning disabilities and mental health. So again, just using that real creative, strength-based approach, thinking about enabling services, thinking about having that really effective transitions pathway as well for people who are coming from younger people's services and transitioning into adulthood. Some of the key things within those work streams, you've got additional sort of information through that. So thinking about how we use technology, how we use adaptations, assistive technology, about how we kind of support people, like say, around their own well-being, as well as what support people might want as well. So we've got a series of work streams under those work streams, so work packages, if you like. So that's going to be happening over the next 12 months to really get that programme of work up and started. We would expect the benefits to be long term, not just for 12 months. We really want to embed that best practice. So it's not a matter of saying we'll change the way we work now and then we'll go back. It's about changing practice now and implementing that long term. The one other thing just to mention that we've got some design principles really around this programme of work. That's included on the final slide. I won't go through all of those, but a couple of ones just to pick out. I think, again, Alexia's mentioned that we've got our new case management system. That will provide us really good data. So we want to become a bit more evidence-led in what we do. So rather than just be quickly responsive to something that might come up, well, let's look at what the data's showing us and then plan and respond our services appropriately. Want to look at the future, like I've just said. Solutions shouldn't just be about where we're at now. We should be thinking long-term as well. But we do have to work at pace, and that's something that we have to acknowledge in this process. We have got, not only we want to support people most appropriately, but there are some savings attached to this work as well, and some efficiencies in the way we need to work. So we do have to deliver some of this at pace as well. So I think that's a general overview if you've got any questions.
Right, thank you for that. Just one point that perhaps could do with pulling out a little bit more.
Yep.
When you talk about re-ablement, enablement, the agenda today is of a move towards care in the home, care in their own home, which of course does have an impact on re-ablement, etc. Because you did just touch on it, but you're not really looking, or I would expect that for the future, you're not looking towards re-enabling people who've been discharged from hospital. You're more looking towards maintaining people and perhaps improving the position.
Absolutely.
Rather than going into hospital.
Yeah, there's an absolute focus on that prevention, early support, admission avoidance as well. So, I think, like I say, a lot of the focus during COVID was about how to respond to what was happening. We need to get back to, well, actually, how do we prevent that from happening in the first place?
Thank you. Right, panel, have we any...
You said about the outcomes and the differences that it would make, and that it would have some cost savings. Can you just sort of expand a bit on those areas? What will the outcomes be? What will the differences people see? And what will the financial benefits be?
Yeah. So I think what we've found is that if I focus specifically on, say, hospital discharge, in that response to support people to come out of hospital quicker, there is a bit of a focus on, and a pressure actually from our acute trusts of, let's step people down from hospital, support them to go into a bed, and then support them to go home. And what can happen is once somebody has been supported to go into a short-term bed, they end up staying there, they become more deconditioned, and then the support to get back home is even more difficult than if we could actually just support somebody to leave hospital and go straight home and have that period of reablement at home. So, we know that people have told us that they would rather live at home than in residential care, generally. Obviously, some people need a different type of support, but in general, people do want to live at home. And if we can put that support in, and if we can make that, the most appropriate, including, thinking around loneliness, how we can connect people to people in their communities and around them, that should reduce the amount of formal care that we need to put in. So I think sometimes there's a temptation to think, you know, we need to put care in to meet every need. For example, somebody who wants to have some social life, but actually, if we can support them to get out and about in their communities, then they don't need that extra support. So there is a difference, you know, in costs between residential care and people being supported at home, and that's where we can make some efficiencies as well.
Can I just... So in terms of when you say about reablement and people going home, are there going home first? Are there different services that you would provide that weren't available before? So obviously, I mean, you were using assistive technology before,
Yeah.
home care services. Is there something different to that? Is the offer different?
I don't think it's particularly that the offer's different. I think the volume that was coming through during 2020-21 was significantly higher, and we weren't able to respond to that volume in the way that we wanted to in terms of reablement. We've got more finances being put into reablement now. The ICB and our health colleagues are investing in reablement as well, so we can get people home first is the approach that we want.
Do you want me just to add to that, because reablement's in my portfolio, just to give you, just to put some context into that, a few years ago we had 8,000 home care hours, we're now at 21,000. So it has been a significant increase in the right direction, because obviously we wanted to put less people in residential care and we wanted to grow reablement, so that was the first offer. And I think the overarching principle of all the work that Kath and myself and our teams are doing is home first. That's the principle, and we have come away from that home first principle. So we want to get people back home with, to maximise their own independence. And there is an element of risk aversion with our acute trust, where they will recommend 4 calls a day. Where in actual fact, when our reablement team go in, it might be 1, and we go in and do a single-handed care and all those sorts of things. So in terms of an holistic offer, AT absolutely, but also we work really closely with our OTs and with our movement and handling team to make sure that we are maximising people's independence at every single opportunity. And it's not just reablement at first point of discharge, it's all the way through, because somebody might be deconditioned but in a few weeks. So it is that sort of retrieve sort of process for that individual. Does that help?
Yeah, so it's not a different type of service per se, it's a culture change.
Completely.
Of expectation.
Yeah.
And it being, I mean, that's interesting about it being an ongoing sort of support, always conscious of how people can best be independent. It's really reassuring to know.
And I think interestingly, through the diagnostic work, they did identify that there was significant downtime within our reablement, and I think part of our change programme is to look at when those that downtime is, because I think unfortunately, again, feeding sort of that acute, it's not just the acute, but thinking about what people want and when they want it. People were saying, well, I want reablement at, a tea time call, or I want reablement at a morning call. Well, actually, that's home care. So we might be doing mixed packages of support for people, because you can be reabled any time of the day. If you need to go up and down the stairs, that doesn't have to be at 7 in the morning or 5 o'clock at tea time. So there's a whole raft of work that sits behind the change programme that's going to start to rethink around culture. What is the offer, and is it a mix of a package for somebody that makes sense for them, but absolutely meets that holistic need?
Just one last one. Sorry.
Go on, then I know Councillor Ali's waiting.
Yeah, I don't know if you can answer this or share it, but in terms of the impact on a budget, are you able to share what that looks like, or how, what's the forecast?
I mean, it's difficult
I appreciate if you can.
It's difficult to quantify, but I think, like Cass said, when you do less of something that's more acute and more complex, the money follows. And quite often people do come up with their own solutions that aren't costly. So I think it's tracking that, and it's making sure that the metrics are right, making sure that the KPIs are right, and in terms of culture for the workforce, it's not putting the most highest package of supporting for somebody. It's really thinking about, what does that person do? What did they do before they went off their legs? And what are the things that they want to aspire to get back to that's not social care, that's not always, costly in terms of that, because let's not forget, people do have to contribute to their support. So quite often, if we talk to the individual about what that looks like for them, they come up with solutions themselves, and quite often, and again, the money follows. It's difficult, and I think that this next 12 months will be really key for us to making sure that we are as efficient with the resources that we've got, bearing in mind that there are less resources this year. Could talk all day, couldn't we, Helen?
Councillor Ali.
Hey, thank you, Chair. Before I ask my question, I just wanted to make a point, really. I think looking at sort of the design principles for your programme, it looks excellent. So, you know, well done on that. And it's nice to see, it's really refreshing to see the focus being around consultation, the approach that you've used, and in particular, person-led, so, you know, taking into account what residents and users want to do. So, you know, really appreciate that. My question was more specific around sort of mental health. You do mention it. Sort of post-pandemic, I think the new epidemic really is mental health. It's really on the increase. Have you put any specific measures in to deal with that or take into account of that, and how will that impact your budget as well?
Yeah, absolutely. We have seen complexity on the rise, and we've seen an increase in people needing to go into residential, which a couple of years ago we didn't see that. People were using STS, self-directed support, much more. So we've seen a shift in that, but there is a work stream that sits behind that, because what we want to understand is what does that mean for those individuals? Do we have sufficient capacity? But also, are people having to go out of area because we don't have sufficient accommodation for those individuals? But like learning disability, there's a work stream that sits behind that to try and understand what that looks like. And I think you're right, it is the new pandemic. We are seeing significant pressures in the system around mental health, but our colleagues in mental health, I work really directly with them. We have a really strong partnership, and we do joint work together. So we are constantly reviewing what that cohort need in terms of access, but also similar to what we're doing with our older people and people with physical disability, it's enablement first. So we're trying to do the preventative work, really trying to work with mental health services to think through. It's not acute, because they quite often work opposite to us. So it's trying to redirect some of that. And again, like anything, it's a bit of a culture change for them. But certainly our trust partners are on that journey with us. So we are working collectively together to try and make sure that the outcomes for people are the best that they can be.
Yeah, thank you. No, that's good to see.
Councillor Munro.
Fine, thank you, Chair. I've had all my thoughts and questions in my head, all satisfied, thank you.
Right. In that case, thank you very much for a comprehensive coverage of the topic there, which I think has been very helpful. I'm sure my colleagues think so. Moving on to item 10 now. I'm not sure, if you don't feel that you have anything to contribute to this, please leave quietly if you wish. Right, so item 10, the panel will receive the Kirklees Safeguarding Adults Board 2022-23 report. Over to you.
Thanks very much, Chair. If I just introduce myself first, my name is Robert McCulloch-Graham. I'm the independent chair of the Safeguarding Adults Board for Kirklees. I've got also with me, I've got Jackie Stanfield with me as well, who's the business manager for the board. And thanks to Jackie to attend, because I know she's injured her leg at the moment, so she's here in a little bit of pain, I think. But she's going to present, she's going to put up the presentation. I'll take you through it. Jackie, could you share it?
Yeah.
That's a nice short answer.
Thanks for that. Okay, if you jump to slide 3, then I can give you a bit of a better introduction about who we are and what we do. Now, I know some of the members that are currently present, so Councillor Ramsey has already seen this presentation, so apologies for that. and also some of the other people in attendance have seen it. But I'll take you through, and hopefully there'll be a bit of a conversation and questions at the end of it. So what do we do? So this page here in the presentation actually gives you an outline of what the Safeguarding Board is all about, really. So we are a board which is made up of representatives from health, that's both the ICB but also the trusts as well, the local authority from adult social care and other services within that as well, also the police, the voluntary sector, and also the fire service are there as well. And together we form an independent board. So even though we've got representatives from each of the services or the professions, when we come together, we really prize our independence, and we provide a degree of challenge in that we try to assure ourselves as a board that we're actually preventing the abuse and neglect of adults within Kirklees. And that's our raison d'etre, that's what we're all about. And I am delighted to be able to reflect on the quality of the partnership here. I chair a couple of other boards elsewhere in the country, but Kirklees is a very mature partnership, and it's able to provide that role of challenge but also support to each of the agencies, and what you have here is a very high quality partnership, and that should feature well within the CQC. We heard earlier around the expected inspection, so that should do well for that. Right, so we assure ourselves that the local safeguarding arrangements are in place as defined by the CARE Act of 2014 and the statutory guidance that's within that. We assure ourselves that the practice is focused on the individual, person-centred, and actually all of the services are looking towards what the outcome is. And we measure those outcomes in regular reports, and we're able as a group to actually provide that degree of challenge to each of those services within them. We work collaboratively to prevent abuse and neglect wherever possible, and we ensure agencies and individuals give timely and proportionate response to abuse that's occurred. And we ensure that practice, or safeguarding practice, is continuously improving and enhancing the quality of lives in the local area. So can you skip on to the next slide? So this slide gives you the structure as to how we actually operate. So we have the board, and I'm the independent chair. And the board, as I said, I explained, is also independent in that nature. And there is a strategic delivery group which helps with the implementation of our aims and objectives within that. And we're also supported by 3 subgroups. So we have the Safeguarding Adult Review subgroup, the Learning Development subgroup, and the Quality Performance subgroup. Now, the important point to mention here is that each of these are chaired by the statutory partners of the group. So it's not all coming through the local authority, it's actually shared very well in Kirklees. I'm delighted by that. And my predecessor was most insistent that that was the case, and we're carrying that forward now. There are some other groups which stand from time to time as and when they're needed. And if I pause on the Dignity and Care steering group, we have got an event that's going to be operating next week through them, where we'll be focusing on unpaid carers within Kirklees. And all of our events are always very well attended, and I'm sure this one's going to be much the same. One thing I forgot to mention in the introduction, there are 3 statutory duties that the Safeguarding Adults Board has to comply with. One is that we need to create a strategic plan across the partnership to undertake those aims and objectives that I've just taken you through. So we have an annual strategic plan, which is renewed every year. Our strategic plan runs over 3 years, but we do renew it every year. So that's our first duty. We have to produce that strategic plan, and we work to that during the year. We also have to respond to any serious cases which may occur. So we would have to commission a safeguarding adult review when we have any case where an adult has either died or has been the subject of significant abuse or self-neglect within those areas. And where we feel that there's potential learning for the partnership or services within the partnership, we will then commission a safeguarding adult review. And we've done a number of those in the past. We have got one underway at the moment, but we are not like other places where we've got significant numbers actually coming through the board. So we're quite fortunate at the present time within that. But we do undertake that and recommission as and when. The third duty that we have is producing this report. So every board across the country has to produce an annual report. Now this document that I'm taking you through just now is in the main a reference document. So it's helpful for people to want to find out about safeguarding adults, and it gives them that intro and gives them the information about who we are, what we do, what our intention is, and how to actually access us. So that's the third duty, and that's what this report does here. So next page, please, Jackie. This is quite a busy slide, and unfortunately it has to be really. There's quite a number of demands or expectations on safeguarding boards, and we've managed to actually outline all of these in the one page. I'm not going to take through all of them, but I'll point you to some of the ones which are particularly important for us here in Kirklees. So nationally, there are 6 safeguarding principles. That's the empowerment, prevention, proportionality, protection, partnership, accountability. It doesn't quite run off the tongue, but those are the things which guide us as our values, and that's our expectation nationally. The next couple underneath is what we have selected as a board as our purpose and our approach and our priorities. And they've been identified, or we've landed on these, following an annual challenge event. So we ask each of the members of the partnership, each of the professions or agencies, to undertake a self-evaluation with regards to how they're maintaining safeguarding within Kirklees. And from that, we move on to a challenge event. As I say, that's an annual event where there's a panel which is chaired by myself, and we interview each of those agencies and really go through their self-assessment and see what the challenges are, how they've maintained that, and really exercising that degree of challenge so we can find out what our policies and what our priorities should be going forward. And that's where we've got the next line of those 5 priorities. They came from last year's challenge event with all of the members of the board within there. Okay, next slide. So looking at those priorities that we've done, just to give you a little bit of a taste, so the rest of the report goes through what work we've undertaken in 2022-23, and just to give you a flavour of that. And also within the report, each of the agencies have provided what work they've undertaken as individual agencies to try and promote safeguarding across Kirklees. So we are a consortium of agencies, and as I say, when we come together, we provide that degree of assurance for all of the agencies collectively whether we're meeting our obligation around keeping vulnerable adults in Kirklees safe. What we've introduced here is an online platform which allows easy access for ourselves and our neighbouring boards and services to get access to the policies and procedures that we use when we're actually embedding safeguarding within that. And this is fairly new for us, but it is actually being well used, and it's been proving itself as a good investment for us because it's giving very quick access to those policies and processes that people require within the safeguarding agenda. Okay, so that was one of the major things that we did in that particular year. Next page. So supporting the workforce, we provide a large number of events and training events. And the dignity and care I mentioned next week, we're going on to supporting the carers. This is reporting on the previous year where we actually joined with the NHS Civility and Respect campaign, and we rolled out some training and large events from that. They're always very well attended in Kirklees. I mean, usually over 100 attendees at each of these events. And the learning programme is extensive within that. And the reports that we get back are always positive. And we've been able to actually spread that wider than Kirklees, and we've had some attendees that have come from other places in the country because of the quality that's actually provided by that subgroup of the board. And we have a quote there from one of the people about how well they felt that went. Now, these are commonplace in Kirklees, I'm delighted to say. Next page. That second duty I talked about around the safeguarding adult reviews, we've done a number over the years, as has every board across the country, and there's now a national library of these reports and reviews and the learning it takes from it. I have to say, one of the disappointing things, I think, nationally is that quite a lot of issues are repeated. So, for instance, self-neglect has become quite a theme within a number of these cases coming through, and we do some deep dives around some of the reviews that we do to try and identify how collectively we can actually change that. And what we've done here is we're now having a focus on what the learning from our SARS are. So at the end of every review, there'll be an action plan to actually meet the recommendations of each of those reviews. What we do periodically, and we'll be doing more of this next year, is actually looking back at previous SARS, where we know that the learning has been embedded, but has it remained in place over a number of years? And that's a piece of audit work or deep dive that we want to take. Okay, next page, Jackie, thank you. So we learn from experience, and we really want to engage with people who are actually using the services, because their views and their insight is incredibly valuable for us. So we now start every board with a story that comes from an incident that service users have either expressed or one of the professions want to actually share with the rest of the board. And it's gone down very well. We've been doing it for over a year now. And our intention actually is to start to collate some of these. Now, not all the stories are positive. We do get some stories which have actually highlighted a particular area of stress within the system or a particular failure that was done, but there's always a positive outcome in the learning that's there for the board and for all of the participants within the board. Now, we will most likely, we intend to actually collate these stories that we've now collected for some time now, and probably produce a book towards the latter end of this year within that. Okay, next. Right, I've already mentioned this, but it's worth saying this actually. We're incredibly fortunate of the partnership that we have got in place with Kirklees, and that's been performing for a number of years. Before I actually attended here, and it's been going for at least 6-7 years, the partnership, at the level that it's been operating. We had a development session recently with the group, and one of the areas that we felt confident in is that the partnership works well with all of the basics, with all the duties that's placed upon us. We do well with all of that. So it's given us a chance to actually raise our heads a little bit above the horizon and to do a bit more of looking towards those wicked issues that are always around, and whether collectively we might be able to get some impact on them. So now we feel that we've got the space with which to do that, and there is the confidence within the partnership, and there's a security within the partnership, which is now going to allow us to do that. So the next few years ahead of us will have a different focus on what we're actually looking at. We'll be trying to actually get into some of those perennial problems around safeguarding adults and vulnerable adults. Okay, thank you for that. And next slide. This is one of those perennial problems, is engagement with the public. So we've always said that this is a major area that we want to move into. And we're hoping to develop this over the next year or so as one of our priorities that we do, that we want to shift away from looking specifically at services, but actually what's happening within our local communities, and how is it we can collectively get in perhaps earlier to do some of the preventative work, which would lessen the degree of risk that some of our communities are facing. At the beginning of the report, in the introduction, I mentioned that all of our services have been under immense strain for at least the last 3 years, and that hasn't really abated. The impact of COVID is still with us now, and we're still dealing with it. And so our services have been operating at a heightened level without a break for about the last 3 years. Now, we couple with that the economic difficulties that we have currently, and also with the war in Europe and other troubles that we're seeing across the globe are having an impact directly on our own communities here in Kirklees. And so we want to be able to provide this engagement across the partnership to see if we can actually reduce the level of risk. And there's a number of specific programmes which we have developed over the last couple of years which have done exactly that. So we've identified particular areas with economic abuse, financial abuse, where we've actually been able to work as a partnership and go in and reduce that level of risk to individuals and provide a response, a quick response to those situations where we find out. That's just one example. There are many to be had. But we hope by engaging with the public more, we'll have more information and insight with that so that we can direct that work. Next. Okay, the challenge event I've talked about, we're just about to move into this year's, and I'm sure it's going to be as fruitful as the previous years have been, and that information from that we will take, and that will further inform our strategic plan. And again, next year we will be reporting that in our annual review. Okay, next, Jackie. And this is looking forward to the last slide here. So looking forward, these are the 6 principles of safeguarding, and we will work within those. But following on from the challenge event from the previous slide, we will be trying to focus our work much more next year, so that we can actually look into much more of the preventative work that we're doing and not be quite so reactive to that. So that's the conclusion. I'll open for any questions that you've got, Chair, or for the panel. Thank you.
Right, thank you very much, and may I first of all thank you and your colleagues for all the work you've put in. It's quite a comprehensive report. You obviously keep yourselves very, very busy and keep up the good work. Now, panel, anybody wishing to ask any questions? Councillor Monroe.
Thank you, Chair. Yes, I'd just like to ask, you touched on self-neglect is becoming a theme. So I just wondered, are you seeing an increase in reports in various different sectors, such as self-neglect? And if you could just talk me through that, please. Thank
you. So we get evidence being provided from each of the partners. So that's right across the board. So health, police, local authority, adult social care. And we do get reports that there are many more cases of that coming through or being identified. So it's not always a negative. It means that more people are actually being identified with that situation. Also our SARS that we've undertaken, the Safeguarding Adult Reviews, not this year, but previous years, we've had a couple of major ones where self-neglect featured highly within that. One was around alcohol abuse, but one was also about how people are discharged from one service to the other and falling in between the gaps. And for some of the individuals, unfortunately, they desire to fall in between the gaps. So it's quite difficult to engage with them. And I think that's one of the issues that we're facing with self-neglect is how do we actually get these individuals, or how do we get the services to actually engage with them in the first place so that they can actually affect their outcomes within them. A multitude of different reasons for self-neglect. It's from some trauma that happened previous in the past, or the situation that they're in just now. So it could either be from a new crisis, or it could be coming from something deep in the past. But it is always down to the fact that our services are there and are able to support, but only if they're able to engage. So it's how we actually get across there. I hope that answers your question.
Yes, thank you. Sorry, what you're saying basically is it's an engagement issue effectively with trying to engage with those people and, and being able to help them from that sense. Yeah.
Yeah. A lot of these cases, people don't want to engage. They're seeking positively to avoid actually getting the help that actually is going to turn their lives around. And that's always been problematic. And it does take individual professionals to be professionally curious, very determined, but also very inventive as to how they might approach an individual in that case. And that's where we look towards the learning. So some of the stories that we get to the board, some of the reviews that we do, and just the work that some of the individuals or social workers or health workers are actually doing, we can learn from that. So where we get a bit of a success, we will be sharing that so that others can learn from that and perhaps try that out. I think Jackie wants to come in as well.
Yeah, so we redevised the self-neglect policy and procedure within Kirklees, and it has actually been commended by some of the partners that do share different local authorities. We have what we call the Risk Escalation Conference, which is made up of senior managers within Kirklees, so where there's a sticking point within the case, that case goes there, and senior managers are able to look at that to see if they can move the case forward. But it also, because we know the professionals, it can impact, you know, these are the cases that keep you up at night. It kind of provides that reassurance you are actually doing everything you're doing, so it's kind of twofold. But yeah, and we keep revising that on a 12-month basis, doing audits to make sure that if there's anything else we can do to move that forward.
Thanks, Jackie.
Thank you.
Thank you.
Colleagues, anyone else wishing to? Right there. Oh, thank you very, very much. And you've stunned my panel into silence. Thank you for your efforts. Thank you.
Okay, thank you very much.
Thanks, everybody.
Thank you. Bye now.
Right, moving on. It would appear that the CQC haven't bothered coming to talk to us. Oh. Yeah, that's my information. So we'll move on to item 11, and that information now changes. This is the work programme.
We'll defer that till April. We'll defer the item till April.
Yeah, my apologies, I'm getting a little bit in front of myself. The only alternative I have to item 7, we do have to listen to the CQC, so that's going to have to be deferred, if it can be done, to the April meeting, which then brings me on to item 11, which is the work programme. So, as I've just said, first of all, we're going to have to alter the April meeting, which is the last meeting of the municipal year. So, we'll be trying to include the CQC presentation in the April meeting. That's down to the officers to discuss with them and see if we can get them to talk to us. It'd be awfully nice. I also will be having, or I'm scheduled to have, briefings about oncology, non-surgical oncology provisions. And I also have Calderdale and Huddersfield something trust, THFT. I have an update, a briefing to come from those about general matters which I'm told will include mental health issues. And as we just heard earlier on, immediately before this meeting, we will now hope to have a report about the CHFT against maternity provisions. So I'm hoping that a digest of the report to the other committee will be available for our April meeting. So we do seem to have a slightly busier April meeting than I had anticipated. We got any comments? You all happy with those changes for a start? Yeah. Any comments or any other ideas? Yeah.
It was only just, it's a shame that CQC haven't been able to give their presentation today because it had a direct link to your presentation. It would have been helpful to have had, to be able to sort of have what they're proposing and then be able to ask you questions about your preparedness for that and what could be expected. So it's a shame that it's not been all at the same time to save people having to come back again.
As the great Scottish poet Rabbie Burns said, the best laid plans of mice and men are oft times gang a glee, and I'm afraid they went a glee here. Okay, on that note, once I get into Scottish literature, we've got problems. So thanks for your help. Thanks very much for your attendance. And thank you, folks. The meeting is now closed.